3 days ago, a young Nigerian lady died whilst doing BBL, Brazilian butt lift. This has caused wildfire across the Nigerian social media because that's what every single person is discussing. And the only question everyone is interested and also asking about is why? Why do a Brazilian butt lift? Now, if you want answers to that specific question, I'll obviously be the wrong person to ask because I'm not the one who did the BBL. Or did you see BBL in my back? But in this video, one thing I'll be trying my best to answer is why not to do a Brazilian butt lift? Why to stay away from this surgery? And why this surgery is regarded as the worst, the deadliest cosmetic surgery ever invented for human. Now, in this video, we will be going to the screen, we will be looking at some human anatomy, and we will be talking about BBL and why you should not be doing a BBL. Now, first and foremost, to understand what BBL is, we need to look closely at the picture on the screen. So this is a picture of a surgeon doing what we call fat extraction. We can see the surgeon using the needle here, trying to extract some fat. Now, what happens here is getting a bit of donor fat to be transferred later to anywhere the person wants. Especially if it's a BBL, you'd expect it to be going down to the buttock. After getting the fat from the donor area, which in most cases is the tummy, because the tummy is one of the areas where people tend to store a lot of fat, and for some people, they don't really get enough fat in their buttocks, which is what they want in this place. They want to look very nice, look like Nicki Minaj, look like Cardi B, and hence, they want a BBL. So this is what a BBL can do. A BBL can turn a buttock that looks like this to a buttock that looks round and full. I mean, it is the wonders of science. You don't have to ask me how it's been done or how exactly doctors know they can do this. Now, having talked about the fun part of the video, we are now at the not so fun part of this video. Because in this part of the video, we will be talking about exactly why BBL is dangerous. First and foremost, let's take a good look at the human anatomy. I know this looks very scary, but it's quite simple, and I will explain it in a bit of a detail. The goal of this picture is not to intimidate you. It's not to make you feel as though you didn't go to school or anything like that. The goal of this picture is to give a full understanding to things that you might not understand before. The thing I need you to pay attention to is this vein called the superior gluteal vein. Now, what does a vein do in the body? A vein helps to drain blood away from the area where it is supplying. For example, if I tell you I've got a vein that leads to my brain, the job of this vein is not to go take blood to my brain. The job of this vein is to drain blood away from my brain. And it is the exact same thing veins do all around the body. Drain blood away from the areas where they are supplying. So in this case, a superior gluteal vein is to drain blood away from the buttock. Now, let's talk about how a BBL works. When a BBL is being done, the job is to inject the fat that has been taken from the donor area. In some people, it could be the buttock. Some people, it could be the thigh. Anywhere they've got enough fat in, this can be used. Now, when the fat has been purified, like I mentioned before, and every other thing has been done to make sure this is viable and this is nice to be injected into the buttock, the next step would be to use a very good needle and then start injecting the fat. Now, let's talk about the danger. The big danger that can happen is the surgeon can mistakenly, and I'll give you based on statistics, mistakenly inject the fat into this vein, which is the superior gluteal vein. The surgeon can mistakenly inject it into that vein. Now, people will think, oh yeah, what's the big deal? It's been injected into the vein. Nah, it's a really big deal. If you can see the blood supply, the way this vein moves around, I mean, this can look quite intimidating, but I'm just trying to show you. Now, the next place that anything that goes into this vein goes to is called the internal iliac vein. Now, if you trace it down, you will see where the internal iliac vein is. The internal iliac vein is also very close to a big vein. The internal iliac vein drains into another vein, which is called the inferior vena cava. It goes into the inferior vena cava. I mean, this is when we start getting into danger territory. And don't get it wrong, this doesn't take 2 years before this fat that has been mistakenly injected into the superior gluteal vein gets into the vena cava. It takes minutes, sometimes seconds. It drains, it goes straight into this big vein. Now, the question is, why is this dangerous? This vein leads to the heart. This vein you're seeing, it goes straight to the heart. Now, if you don't understand how dangerous this is, it only takes 1, 2, 3, and then the 4th step is we're talking about the heart. Where does the heart supply at this point in time? We're talking about the lungs. In very few seconds, you can have a patient who can no longer breathe on the table anymore. You can have a patient who is going to be breathing their last breath just because someone had mistakenly injected that fat into the superior gluteal vein. Now, for so many people, you'd say, oh yeah, I mean, it can't be that bad. It can't be that bad. Why are people making big deal out of BBL being dangerous? Let's talk about the statistics. 1 in 3,000 people will die doing a BBL. 1 in 3,000 people. This statistics isn't talking about the statistics of some of the best surgeons in America. And it's also not talking about the worst surgeon somewhere in Lagos, Nigeria. It's considering everyone together. So we've got some surgeons in America that they almost never have anyone lose their life. And then we've got some surgeons in Nigeria that for every 2 surgeries they do, 1 person is no longer going to be alive. And it is for this reason why BBL is extremely dangerous. And it is the reason why BBL is called the most deadly cosmetic surgery you can do if you're a human being. At the end of the day, I know this video, despite how much detail I was trying to put into it, people will still watch it and decide I am booking the next flight to Turkey to get my BBL, because sometimes our emotions are more important than when we use our brain. So in conclusion, BBL is not a safe surgery. BBL is not a good surgery, except you're doing it for constructive reason, except you're doing it to save your life, which I don't know how many people do BBLs to save their life. I do not think it's a surgery people should be participating in, and there are other ways to get your desired nice looking round fatty buttocks. You can always go to a gym. It is something you can do. It's not so expensive too. £20 a month. If you're in the UK, in Nigeria, I bet it's less than 10,000, 15,000 a month. You can always do enough squats. Have you seen the picture of that guy who is called Squat King from South Africa? I mean, that's a guy and he's able to achieve that. You can always achieve it yourself. You guys tell me what you think about the video. Have you learned a thing or two from this video? Or there are things you like me to make changes in? Thank you very much for watching the video once more. And once again, stay away from BBLs. Thank you very much.